we'll get. Okay, here we go. So another Zoom call. We have a bunch of questions that got sent in. So we're going to get to those first, and then you can chat in whatever questions you want anytime you want. Remember, always, if you have questions between these Zoom calls, to go to our website and look at that little magnifying glass, and you can search for something. We have almost 1,000 pages on our website with information, so you may find it already there. Hopefully everybody's on the membership site. I know some people have sent in questions to me via email. Please do that on the membership site. There's a spot under in all the pages that you can ask, that you can submit your Zoom call questions. And some of you are emailing your liaison those questions. Please use the membership site for that if you can. It's the best way not to get a question missed. We'll also have announcements on there. If you haven't been on the membership site, you haven't seen that we're added a Zoom call Mondays at noon with Ann. So take advantage of that. Ann is doing the Zoom call Mondays at noon. So she'll be answering questions as well. And that's a place where you can jump on. Same feel as this, but it'll be Ann doing those. All right, here's some questions. With bladder cancer, would small chunks of tissue be coming out with her urine? This is the person talking about her mother's bladder cancer. If the Rife attack on the tumors is working. Yes, that can be true. That can be true with other cancers too. We've had people with colon cancers or rectal cancers where they start using the Rife, start using a nutritional protocol. So I don't know if it's the Rife or their supplements or what's doing it, but the tumor's dying and pieces are falling off. And you could be passing them in your stool, or you could be passing them in the urine. I can't say with certainty that that's exactly what's happening. It could be something else. So I don't know, but yes, we have seen that happen. She hasn't been able to eat well for some time, so has not been taking the supplements for about 3 weeks, but I've been running the overnight sessions twice per day, and now mottled-looking grayish chunks are being expelled. So let's pray that that is what's happening, that the cancer is being killed by her immune system. That's what we want to be doing. Is it okay to use the P4L PEMF machine following tumor embolization and insertion of a plate and screws into the humerus due to a pathological fracture? Yes. So the PEMF is not going to interfere with any metallic inserted device in your body. The PEMF will interfere if you have a defibrillator. So if you have something that's an electronic device, that's a totally different thing. But a metal plate, screws in your leg or anything like that is no, you can still use the PEMF with that. It's only a defibrillator that you have to be concerned about with PEMFs. Are you familiar with quantum physics? A little bit, especially with the AO scan instead of a PET scan. So I think the AO scan is, sometimes I don't look at these questions before I'm answering them. I do apologize. I believe the AO scan is like the Zyto scan. Yes, that's what it is. So that is, you're not comparing apples to apples here. A PET scan is completely different than an AO scan or a Zyto scan. It's completely different. There's benefits to Zyto scan. There's benefits to the AO scans. There's numerous different types of frequency type scans like that on the market that practitioners can use, and there's some benefit to them. I would be very careful diagnosing off of those. Some practitioners take that to the nth degree, and because of let's say bacterial frequency you got a hit on a bacterial frequency on one of those scans, then they say that you have that bacterial infection. That is not true. So there's misuse of any device. You have to be careful with that. It means that you had a hit on that frequency, and maybe that frequency would be good for you, but it does not mean you have that disease. It certainly is not a substitute for a PET scan. I mean, it's like saying, should I drive a car to work, or should I eat apples? Well, we're talking about two different completely things here. That's how different these two things are. So it's certainly not a substitute for a PET scan. Question that came in before I answer this one. Does the hammer bulb have to be next to the skin? Will it work through clothing? No, it will work through clothing. It doesn't need to have a skin-to-skin contact. It'll go through clothing. But we do have some people that say, is it all right if I'm using the hammer bulb if it's 3 feet away from me? So remember, the farther you move any of the bulbs that you're using with the rifle away from you, the lesser impact it's going to have on your body. So the closer it is to the body, the better impact it's going to have on your body. So you do want to have it as close to you as possible. Clothing really doesn't make any difference. It'll go through clothes just fine. This question on the slide, are you familiar with LifeVantage products, especially the Nerf 2 products? Would this be good for breast cancer? I'm not familiar with the LifeVantage products off the top of my head. I'd have to look them up. The Nerf 2 product should be fine. The Nerf 2 pathway is basically stimulated with turmeric and some of the flavonoids, and that's probably what's in that product. Most of the Nerf 2 products that are out there have those in there. Those should be fine. Before I started on your program, I was put on a keto diet and lost lots of weight. I'm just copying and pasting these from your things here. So 5'7", and right now I weigh about 113 pounds. That's pretty teeny for 5'7". I also have low thyroid. So low thyroid will typically cause a person to have difficulty losing weight. I am struggling to put weight back on right now. Can you help me with that? And also, can you help me regulate my thyroid? So if you're struggling putting weight back on, it can be due to the diet that you're on. It can be due to that you have you've been diagnosed with hypothyroid and you're taking too much of its replacement, whether you're on Synthroid, a synthetic thyroid, or whether you're on a natural substance. You can take too much of it and you will end up putting your thyroid in a state of relative hyperthyroid, and you will lose weight and have a difficulty putting weight on. You can have difficulty putting weight on because of the cancer. And then there's subsets to that, maybe because of the cancer and it's causing you to have some nauseousness or inability to want to eat and you're not eating enough calories, or because of the cancer and you have anemia. And the anemia is because it's called anemia of chronic disease. When you have anemia, low hemoglobin, low red blood cell, and it's because the cancer may be feeding off of iron. So there's multiple factors that could be going on, and we need to dig into this a little bit. My doctor doesn't seem to understand any more than the normal blood tests. My genetic test isn't back either. The genetic test won't really tell us why a person's not able to gain weight. So really, we should have a consult and talk about this a little bit deeper. So we may want to do a better thyroid test, or look at the thyroid test that you may have had so we can investigate that and investigate your current diet, whether keto is right for you or not. Keto, if you're on a keto-like diet at this point in time, you will lose a lot of weight. Typically, that's a diet that people will choose to lose weight because you're basically starving your body of carbohydrates, trying to get yourself into a state of what's called ketosis, where your body's feeding off of ketones, which can be good for certain cancers, especially brain cancers, but not necessarily for every cancer, because most people on a ketogenic diet then are eating either more protein or more dairy, and dairy is not good for most other cancers. So we need to make sure that we're discussing this. At times, the skin on my breast tumor is pinker than others. Yes, that can be, I think you're talking about it's pinker than other times. So that can be true if there's a relative state of inflammation there, which is good, which was what we're trying to do. So we're trying to cause a relative state of inflammation at different times, and it's better in surges like that, because what is inflammation but it is an immune response to the area. So that's what we're trying to do. So that, I would say, is a good thing. Can circulating tumor cells be zero via a blood test, but a tumor marker be increasing? The answer is yes. So you can have circulating tumor cells at a state of zero, meaning I do a blood test for circulating tumor cells and there's no circulating tumor cells seen in that blood that was taken out of your artery. Well, that's a great thing, but it really doesn't. That's why I don't recommend people do circulating tumor cell tests, because it's not how much circulating tumor cells you have at this point in time circulating in your blood. It's how it's that at some point in time that you had cancer, some point in time that this cancer was growing in you, possibly even pre-diagnosis of cancer, you had circulating tumor cells. And it's not the circulating tumor cells in our blood that is a concern, it's the circulating tumor cells in the tissue that are still considered circulating tumor cells, or maybe a better term is cancer stem cells, that maybe are not in a state of rapid replication yet. That's what we're concerned about, and that's not measured. There's no way to measure that. So to me, I don't see value in doing a circulating tumor cell blood test, because it can give us an idea of, oh, look, I have a zero circulating tumor cells, so I'm really doing really well. That doesn't mean that at all. That means you have zero circulating tumor cells in that, so many milliliters of blood that was drawn out of you. So that doesn't tell you where the tissue's at, but you may have had circulating tumor cells 18 months ago that are still dormant in the tissues. It doesn't tell us any of that. CEA increase or any tumor marker increase has to do with an increase, possible increase of growth in the cancer. Just a slight increase might be nothing. Like any other test, you have to balance that with other tests and signs and symptoms as well. So CEA or any other tumor marker spike more highly suggests that the tumor is growing. That could be from the primary tumor, not from a secondary tumor. So there's too many factors going on there. How long can one use IP6? So IP6 is a nutrient that can be good to help your body kill cancer. It can be a chelator as well. I'm taking 3,200 milligrams AM and PM. Can this affect my own iron? So that's a good thought process there. So can taking a chelator like IP6 actually decrease my iron level by maybe chelating iron out of my body? That's possible. Yes, that is possible. So I like the way this person is thinking, because that is a possibility and is something that we may want to investigate. And one of the things you can do is just kind of go on a trial. I'm going to drop IP6 completely for 2 weeks and retest my iron. Does my iron go up a little bit after those 2 weeks? Because your body is going to produce iron during that time, and it might bump it up a little bit. That could be a good experiment. To clarify the no white potatoes guidance in her prescribed diet from Dr. Connors, we're wondering if she can still have red potatoes, gold potatoes, or purple potatoes. Can you help with that, please? So when we're asking a person to limit their white potatoes, the reason why is that potatoes have a higher glycemic index than even table sugar does. So meaning you will break down potatoes into glucose even quicker than you're breaking down sucrose, which is a disaccharide, into glucose, which is a monosaccharide. So glucose, which is a monosaccharide, which is one ring, organic chemistry wise, then is glucose is what goes into the cycle of your body breaking down into produce ATP, which then produces uh, 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 two CoQ A molecules, and which can then convert to lactic acid, which then can then be a feeder of cancer. So that's the idea of glucose, sugar being a feeder of cancer. When we say that sugar, I mean, we're using that term grossly because sugar incorporates any saccharide molecule like sucrose or glucose or galactose or fructose. These are all sugars. So more complex sugars, aka carbohydrates that are found in white potatoes, some ironically can break down to glucose faster than even a disaccharide like sucrose. So when we say to a person we're trying that their cancer may be feeding off of glucose and the breakdown of glucose to lactic acid, we say limit your white potatoes. It's because of that. Now, to get specific to the question, red potatoes, gold potatoes, purple potatoes, pink potatoes, green potatoes are all fitting into the white potato category. So the only thing that doesn't fit into the white potato category that are still called potatoes are your yams or sweet potatoes. Now, I know those are two different things, but both yams and sweet potatoes are technically not potatoes. They are in a different class and they don't have the same glycemic index, meaning they don't break down to glucose like potatoes do. So any potato, so when we say white potatoes, maybe we need to clarify that a little better in that form. We're talking about red potatoes, Yukon gold potatoes, or any potatoes. So I should have been more prepared and pulled up a picture of my potato patch this year because my wife and I are avid gardeners. We do have to make some videos of our garden. We have tons of raised beds that I build, and I went nutso this winter. I built 19 new raised beds, and we grew a big patch of potatoes in our raised beds last year. And when you're raised bed gardening, potatoes do take up a lot of space. So I just dedicated one raised bed to potatoes last year, and it was just so much fun. We ate them all so fast, we didn't even get to store any for the winter. That I put another bed into a raised bed into potatoes this year, and I actually bought myself for my birthday a rototiller for my bobcat. So we live out on 20 acres and I've had a bobcat since we moved there. And the rototiller for my bobcat sparked me to, okay, my wife thinks I'm addicted to this now. But I tilled up this giant bed and planted um, five rows of about 50-foot rows of potatoes. I don't know what we're going to do with 600 pounds of potatoes, but if anybody needs potatoes, you just come over to my house because we're going to have to put up a roadside stand at the end of our driveway giving away vegetables. Because I don't know, we got so many zucchini right now. I don't know what to do with them. We're just throwing them all in the compost. But it's fun growing things. I love growing potatoes, and potatoes are great, but they have a high glycemic index, unfortunately, and they break down to sugar quite quickly, but they're fun to grow. All right. That's it for the questions. I kind of flew through those today. So any other questions you need to chat in, now is the time to do that. Do the questions go to both Monday and Wednesday calls from the site? Yes, they do. So if you have questions that you specifically want me to answer, then just mark that. We didn't create a separate question box for the Monday call for Anne, but she does say, she does tell me that, hey, I'm not sure if I answered this question right, or at least she said she will. She hasn't had to do that yet. Can you answer this on the call on Wednesday? But she will do that. She's very knowledgeable, but she's also very humble, and she won't try to answer something she doesn't know to answer for. If you want one of your questions that you put in the question spot of the member site that you want specifically for Anne to answer, then just say Anne and then ask the question. If you want it specifically for me to answer, then say Dr. C and then ask your question, so that she'll just push it to me or I'll just push it to her. Her Zoom calls are also recorded, and you'll see them on the site as well. So they're already up there. Any tips on how to grow broccoli sprouts? Oh, that's a good question. I don't have any tips on that. We grew sprouts years ago, but it's been a long time since we've grown sprouts. That's a good YouTube question. There's people that's all they do. So I don't know that. Sorry. I've been anemic for a while now. Today, my doctor suggested starting an iron supplement. Do you want me to send a cheek swab to you and wait in your recommendations? Send me the labs first. I want to see if that's what we should do, and we'll go off of that first. That is always a catch-22. We talked about that a couple of weeks ago. Person has, anemia with low iron, and it's quite possible that the cancer is feeding off of iron, and we give it iron to deal with the anemia. So you start taking an iron supplement, and aren't you basically feeding the cancer? Yeah, it's really difficult. That may be true. So sometimes it's better to not use iron if the anemia, quote unquote, diagnosis on the blood test is showing in a more mild state. It might be better to use food-based things to help build that up without directly giving iron, meaning like beets, beetroot powder, liver, spleen supplements, things like that, instead of giving iron. It's also with anything, I think we talked about this last week or the week before as well, with anything, you have a blood test showing low iron, low hemoglobin, you always want to ask the question, why? Why is it low? Is it because I have a deficiency in iron? Well, that can be true with some people, but most likely it's not true with you. It's more likely true that, the first thing you want to ask is why with anemia, is there a loss of blood somewhere? So are you bleeding somewhere? So you want to investigate that. Then the person has a diagnosis of cancer. Okay, is the cancer gobbling up the iron? Is that what's taking place? The other thing with low hemoglobin and low red blood cells, you do want to look at B12 issues. That could be a possibility, especially if it's in the mild category. So those things you want to look at. So send me the blood work first. Can we just pop on either Zoom then? Absolutely. Yep. So you could, that's what these are for. So these are for you. This is a new Zoom call with Anne on Mondays. You can jump on both Zoom calls. You can do it every day if you so desire. I mean, every week you jump on Anne's and jump on mine. You can ask us the same question, see if you get a different answer. No, I'm just kidding. Don't do that. But that's what these are for, just for you to get more help. We're moving more and more towards the Zoom type platform instead of one-on-one calls for a couple reasons. Number one, it saves you money by you asking questions over the Zoom. Oh, this is a real intimate question. I don't want to ask an intimate question. Well, that's why you send it on the member site. You send the question in because then, you know, your name isn't on there. I know people can see your names and such sometimes on these on the chats. Uh, but so send it in anonymously. It'll always be anonymous if you send it in through the member site. And secondly, we're trying to move towards Zoom because from a medical legal standpoint, we get harassed by state boards. Minnesota State Board is attacking us right now. So um, that's why we pulled all our testimonial page off of our site, because the Minnesota Board is, oh my gosh, it's just horrible. So this is what we have to go through. So if we're doing everything on a Zoom, this is all educational. We're not performing telemedicine. So they can't get at us. So we have to keep ourselves protected in order to keep doing what we're doing. Okay, question. I thought IP6 removes iron from tumors, but it does not touch the iron that is tightly bound to hemoglobin. Well, that is true, but I'm just saying that that's what they, the results of some studies have shown, but we just don't know. If a person has anemia, also they're taking high doses of IP6, it could be chelating. IP6 works as a chelator. So when we used to see years ago, when I see a lot of non-cancer patients that had heavy metal toxicity and different things, we used to use IP6 a lot for chelators. So it will chelate metals out of your body, and it can chelate iron before it's bound to hemoglobin. So it can be chelating the iron out, so it can end up being possibly a cause of anemia. And I didn't think about it until this question was asked. That's why I said this is a great question. That's why I love your questions, because I learned from your questions. It could be a cause of anemia. That's a possibility. Using a chelator could be a cause of anemia. Of course, it would only be a mild anemia. It's not going to cause a more serious anemia. So, all right. Still bleeding daily with bladder cancer. Suspended Rife for 3 weeks since having gout-like attack on knee after ER visit and prednisone. D is back to normal. Should I go back to the right? Yes, please go back to those and keep me posted for sure. I'm on day 49 of my second round of Black Sap. Yes, I got your email today. Thank you for that. I love all those pictures. This seems to take a long time, though I'm thankful not have to start the next round yet. Any concerns about the length of time? No, not at all. Dealing with another patient with melanoma, and I think this is one of his last applications. And it's just not coming out. It's just seems to be drying up, and truthfully, it may be healing underneath, and it's just going to fall off. And you're going to see a lot of healing underneath. That's a strong possibility. Is it possible to begin Black Salve after chemotherapy treatments when there is still residual disease? Yes, but remember, Black Salve, we're talking about topical Black Salve, isn't going to work unless you have cancer right near the surface. So that's why Black Salve works so well on skin cancers. Skin cancer technically is, there still have layers of epithelial cells over the skin cancer, but it will eat through a couple layers of cells. It's not going to eat through, down a centimeter or something like that. It's just not going to pull and draw that deep. So it has to be really, really close to the surface. The nice thing about you trying black salve, if that's what you're trying to do, is pull it out and draw it out. The nice thing is that if it doesn't work, it just doesn't work. It's not going to hurt your skin. The bad thing that you have to be prepared for if you're using black salve on a cancer that hasn't broken through the surface yet, it's not necessarily a fun thing for the cancer to break through the surface. For some people, it's like, I just want to get it out. I don't care if it breaks through the surface. I don't care if I have a wound. I don't care if I have to deal with dressing this thing on a daily basis. I want this out, and I don't want to do surgery or a mastectomy or whatever. I want this out. Some people are like, gross, I can't handle this. I'm going to get queasy. I'm going to get sick. Well, then using black salve is not for that person. So you have to be mentally prepared for it as well. And that's a big thing. You have to be mentally prepared for it. So typically with black salve done on the breast, there's not a horrible amount of pain where you have to go get prescription pain meds, but you may have to take Tylenol or Advil or some over-the-counter pain med. If you have a skin cancer, a melanoma, there can be a lot of pain. And understand the pain is not the killing of the cancer. The pain really isn't at the cancer itself. It's the stretching of the skin. So many times a melanoma may look like it's a centimeter around on the skin, and you put black salve on it and starts eating it away, and it's really the size of, a hard-boiled egg underneath the skin, and it's going to do a lot of stretching of the skin, pulling it out, drawing it out, and it can hurt like the dickens. And you may need to be prepared with some medications. How long does it take for the video to be posted on the site? I think I missed your answer to your question. If so, it should be posted right away. The only caveat to that is sometimes I'm recording on Zoom and it's nothing that I'm doing, but Zoom messes up and then all of a sudden the recording like disappears to nowhere land. That's happened about 3 times so far this year. So that's why I said, God willing, that just pray that recording works. Otherwise, just if it doesn't work, then let us know and I'll answer that again. So, and then, so look on the site, and the recordings are typically up just maybe 15 minutes after the Zoom goes over. Any other questions? If the mass is easily palpable, is that considered close enough to this for the salve? No, no, it has to be, it has to literally be within a few millimeters of the surface. So it may be, the thing is, you could try black salve. If it's not going to draw, it's just not going to do anything. It's just going to flake off and your skin might be a little bit red, a little bit irritated, but it just didn't do anything. You could try it again. So there's really no harm, no foul in trying. So some people will use black salve on, oh, I don't know if this is a melanoma or if it's just a mole, and they'll try it on the mole, and it just really won't do anything typically to a mole. It will really only kills cancerous cells. So Can I ask Ann about my new short daily program to know what I am working? I don't know what your question is, what you are working. So your short daily program is for your cancer. So, um, there's a few people that I made specific daily programs for something other than cancer that they are dealing with. Some people have more than one diagnosis, but I don't think I did that for you off the top of my head. Any danger in trying black salve on a red spot on my temple area of my 72-year-old father? Yes, there is danger of using black salve on your face. So think of what it did to your breast. And I don't need to say anymore. So you could get scarring. So you just have to be careful. Typically, if it's a red spot, it's not a melanoma. So if it's a red spot, what's really common on people that as we age on our face are basal cell tumors. So basal cell cancer is totally different. You don't need to use black salve on basal cell. So basal cell cancers, I would try different essential oils to begin with. Oregano oil tends to work well on basal cell. Multiple different oils do. So you could try frankincense. You could alternate some different oils. Also, we created a curcumin cream that works really well on basal cell too. But I would try the oils you probably have at home already. And you just put a drop on your finger and put it on that spot. I would do those. I wouldn't do black salve. It is really hard to keep my black salve dry between the summer heat, sweating, and excessive draining, bleeding. Boy, I know it is hard. Will the black salve still work as well as it should be? You may have to reapply a little bit if it just gets really wet and starts to fall off or something like that. It seems I'm not losing as big a eschar as I expected. Don't worry about that. You're going to be reapplying. You're going to be getting it. So I would say just keep up. People get concerned because they see a video on YouTube or something. It's like, oh, mine doesn't look like that. I tell you, everybody's looks different. So don't worry about that. Just keep it up. Okay, I think we'll end it for today then, and we'll get this recording up as soon as possible. Remember to send in your questions on the members page for those who haven't, and utilize those members pages as best you can. All right, thank you, everybody. We'll be praying for you. Please keep praying for us, and we will talk next week. Make sure you get on Ann's Zoom call as well, and just try to meet everybody's needs as best we possibly can. All right, bye-bye.